Your skin instructor's tip of the week. When you're performing an acne consultation, challenge yourself to identify the dominant lesion types before you ever discuss products. Are you seeing mostly blackheads, closed comedones, papules, pustules? The answer can completely change your treatment strategy. A client with primarily comedonal acne may need a very different approach than someone with widespread inflammatory acne. And a client with deep nodules or cysts may need medical intervention in addition to aesthetic care. The best treatment plans don't start with products, they start with the assessment. The more specific you can become in identifying lesion types, the more confident you'll become in choosing the right treatment plan and setting realistic expectations for your clients.
Welcome back to the Skin Instructors. I'm Morgan.
And I'm Jolie, and today's episode builds perfectly on last week's discussion about acne ingredients because before we can decide which ingredients make sense, we need to know what we're treating.
One of the biggest mistakes I see in acne treatment is the misconception that acne is a singular condition. In reality, acne encompasses a range of different grades, lesion types, levels of inflammation, and treatment considerations. It's important to recognize these differences to tailor an effective treatment approach.
Exactly. Two clients might both tell you they have acne, but one may have mild congestion and a handful of closed comedones, while another may have widespread inflammatory lesions, cysts, and permanent scarring. Those clients should not be receiving the exact same treatment plan. The goal of today's episode is to help listeners better understand how acne is classified, how to identify what they're actually seeing, and why correct classification changes treatment outcomes.
So let's start with acne grading because this is one of the most common systems used to classify how severe someone's acne is. So when we talk about acne grades, we're essentially describing how severe the condition is and how much inflammation is present.
One acne is often considered mild acne. This is where we see mostly non-inflammatory lesions like open comedones and closed comedones. These are the clients who often say, I don't really break out, but my skin is always bumpy. They may have blackheads across the nose, congestion through the forehead, or clusters of closed comedones along the cheeks, but very little redness and inflammation.
And then grade 2 acne introduces more inflammatory lesions. So now we're going to see papules, occasional pustules in addition to comedones. At this stage, inflammation is becoming a larger part of the picture, and those treatment plans are often going to need to address both congestion and inflammatory activity.
And then grade 3 acne is moderate to severe inflammatory acne. We're seeing more widespread papules and pustules, larger areas of inflammation, and often a greater risk of post-inflammatory hyperpigmentation and scarring.
And then lastly, we have grade 4 acne, which is that severe acne. This is where we may see nodules, cysts, significant inflammation, pain, and a high risk of permanent scarring. These are often the clients where collaboration with a dermatologist is going to become very important.
So one of the most important distinctions estheticians can make is understanding the difference between comedonal acne and inflammatory acne, because these two presentations behave differently.
They do, yep. So comedonal acne is largely a problem of follicular obstruction. So we see open comedones, which we call blackheads, and closed comedones, which many clients describe as tiny flesh-covered bumps under the skin. Inflammation isn't the primary issue here.
And then inflammatory acne is different. Now we're seeing the redness, swelling, tenderness, and an active inflammatory response. This is where we start seeing papules, pustules, nodules, and cysts.
Yep, and understanding which type you're dealing with often influences which ingredients you select, how you plan your treatments, and the client expectations. So let's break down the common lesion types because clients often use these terms interchangeably.
A papule is a small, raised, inflamed lesion without visible pus. These are those red bumps that clients often want to squeeze, even though there's usually nothing to extract.
And then a pustule actually does contain visible pus. And this is what many people think of when they imagine a traditional pimple.
Nodules are much deeper. They're firm, inflamed, often painful, and they're located deep within the skin. You cannot extract that.
No, please don't. And cysts are going to be typically larger, deeper, inflamed lesions that can be painful and carry a significant risk of scarring.
The deeper the lesion, the more cautious we need to be about expectations and treatment timelines.
Yeah, absolutely. You know, one question we hear all the time is whether acne is hormonal. And while we can't diagnose hormonal imbalances, we can recognize patterns that often suggest hormonal influence.
Yeah, the classic pattern is the lower face involvement. So your jawline, your chin, neck. And many clients also report cyclical breakouts that seem to worsen around, certain times of the month around their cycle, their period.
And that hormonal acne often presents with deeper inflammatory lesions and may even be more resistant to traditional acne treatments.
And then this is where collaboration with medical providers can sometimes make a difference in the client's skin.
Agreed. All right, so you have a client come in and you hear the word congestion versus acne. What's the difference there? I feel like this is one of my favorite conversations because I think congestion is frequently mistaken for acne.
Yeah, I absolutely agree because not every bump is acne and not every blackhead's acne and not every congested follicle requires an aggressive acne treatment.
Many clients have congestion from product buildup or inadequate exfoliation, maybe heavy cosmetics or lifestyle factors.
And if we treat simple congestion like severe acne, we often end up creating that irritation that doesn't need to exist. So oftentimes with congestion, it's, more of when you're extracting it, it's that little squiggle that comes out of that little white squiggle. Yeah.
They're my favorite.
They're so nice to extract. They're so easy. And there's not usually any inflammation present, that redness, those painful bumps, things like that.
It immediately goes flat.
Yeah.
I love it.
I do too.
Another challenge is that not everything that looks like acne is actually acne.
Yeah, let's talk about acne mechanica first. So this is acne that's triggered by friction, pressure, heat, or occlusion. Think helmets, sports equipment, face masks, chin straps, or even some workout clothing.
Yeah, and then we have acne cosmetica, which is often associated with pore clogging products or just the use of cosmetics.
And one of the biggest areas of confusion right now is that fungal folliculitis.
Yeah, many people call it fungal acne, even though it technically isn't acne at all.
Correct. Yeah, these clients often present with those uniform itchy bumps that don't respond to traditional acne treatment, which can be an important clue during assessment.
Now let's talk a little bit about Fitzpatrick types because acne treatment also doesn't look the same across all skin tones.
Yeah, one of the biggest differences we'll see is a risk of post-inflammatory hyperpigmentation. So clients with deeper skin tones often aren't just concerned about the breakout itself, but with the mark that remains afterwards.
Yeah, sometimes the pigmentation is going to last longer than the acne. And I agree. I think clients that I've had with darker skin tones are more concerned about the pigment.
It's harder to get rid of afterwards. So that means treatment plans need to consider inflammation control and pigment management from the very beginning.
Absolutely. Put them on that tyrosinase inhibitor day one. All right, now getting into the heart of today's episode. Correct classification is going to change everything.
It can influence product recommendations, your treatment selections, your referral decisions, your treatment timelines, and the client's expectations.
Yeah, and when we understand what we're seeing, we can create much more targeted and realistic plans.
One of the most important responsibilities we have as estheticians is recognizing when a client needs that additional support.
Agreed. Yeah, if we're seeing significant nodules, cysts, widespread inflammation, severe scarring, or acne that isn't responding appropriately to treatment, that may be a situation where medical intervention becomes necessary.
Because our goal is always the best outcome for the client, and sometimes that outcome requires that team approach.
Agreed. I think one of the hardest conversations we have with acne clients is truly setting those expectations with them.
Yeah, because many clients expect like dramatic changes within a few weeks, and that's truly just not realistic.
Yeah, acne treatment is a process. We have to account for cell turnover, inflammation reduction, healing time, and unfortunately, often pigmentation improvement.
Most clients need to think in terms of months rather than weeks. It could take at least 3 months to start seeing acne clearing up.
Yeah, something that's festering deep down in there, it can take 3 months just to come to the surface.
Absolutely.
It's frustrating, but helping them understand that from the very beginning is really going to improve compliance and reduce frustration. You guys are going to just have a better relationship.
Totally. Okay, so your homework this week is to spend time looking at acne a little differently. Instead of simply labeling a client as acne prone, start identifying exactly what you're seeing. Are you looking at comedonal acne, inflammatory acne, some hormonal patterns or congestion, and something that may not actually be acne at all?
The more specific your assessment is, the more specific your treatment plan can become. And that's where better outcomes start.
Thank you so much for joining us for another episode of the Skin Instructors. If you haven't already, please subscribe on our website and join our community called Extra Credit. We'll do monthly drops of this, and it's just more information for you. You can also follow us on Instagram at SD Training and visit us at our website at www.sdtraining.com.
We'll see you next week. And remember, don't hesitate to educate.